Dr. Trump. But millions of people are signing up for care, and none of them think this law is a complete catastrophe.
My blood sugars went way up, and I couldn't even go to the doctor to find out what my average blood sugars were because I had pre-existing condition at that point, and they wouldn't pay for all the tests.
So Alan enrolled in a healthcare marketplace plan and was pleasantly surprised.
A lot of people that are falling through the cracks, like myself, people that have good jobs, that have no jobs, and everybody needs some insurance.
What are you hoping to walk away with today?
Some health insurance.
Their monthly premium dropped from about $1,300 a month to $900.
Looking at the different plans, Human selects one he can afford.
Congratulations, you are now enrolled in Humana.
I'm covered.
You are covered.
Getting people covered, saving them money, stopping insurance companies from discriminating against people with pre-existing conditions. That's not a catastrophe. It's a godsend. And we've got one more week to prove it. Joining me now are Congresswoman Karen Bass, Democrat from California, and MSNBC's Crystal Ball. Thank you both for being here.
Thanks for having us, Reverend.
Congresswoman, 1 week to go. What are you hoping to see?
Well, I am hoping to see the continued interest, involvement, and people signing up. You know, over 2 million people have signed up in California, and this coming Saturday in my district, we're doing a town hall, and we expect hundreds of people to be there. And so I think that we're going to have a lot to celebrate next week.
Wow,
this is a great
that's
start.
great. That's great. You know, Crystal, we're also seeing signs that more states will expand Medicaid. For example, in Florida, a Republican state senator is pushing an expansion bill, a Republican. In New Hampshire, the GOP-controlled state Senate has passed an expansion bill. And aides for the Republican governor of Utah have traveled to Washington to meet with officials of the Obama administration about expansion. I mean, is this just the beginning?
I think it is just the beginning. I hope it's just the beginning. There's also movement in Missouri, which has a Democratic governor, but also in Missouri, Republican legislators are pushing Medicaid expansion, and they've done a whole study showing that it would save the state money. So they are paying money, in effect, right now to deny people care. It is absurd. And you've also seen the Moral Monday movement, which started in North Carolina and is now spreading across the South and other places in the country. And they've made Medicaid expansion a real focus of their grassroots activism, which seems to be gaining momentum and putting a lot of pressure on these politicians.
Now, you know, Congresswoman, the Supreme Court will hear arguments tomorrow in the case of a chain store, Hobby Lobby, challenging the contraception mandate. The right claims it's about religious freedom. Listen to this.
The Hobby Lobby case is far more than a case about the one retailer or about contraception. It ultimately is going to reveal whether religious liberty still exists in America.
We have never seen an administration with such hostility to religious faith.
By passing Obamacare, he's denied religious liberties to millions of Americans across the country.
What's your reaction to that, Congresswoman? Is this about religious freedom?
I don't think it's about religious freedom at all. I think it's about the same old song that gets sung all the time, which is denying women the right to choose, denying women the right to have control over their bodies. I mean, you know, we've had hearings here almost on a weekly basis about the same subject, and I really think that it's sad. You know, when you think of health care reform, you are literally talking about saving people's lives. For people to be covered and not have to worry about a pre-existing condition or not have to worry about a cap, and to see this being used as an excuse to deny women health care coverage is really pathetic.
Yeah.
Crystal, your view on this hearing tomorrow?
Yeah, well, in one way, Mike Huckabee is right. The Hobby Lobby case does have much broader implications. It's really about whether a corporation, whether your employer can decide what kind of health care you're going to have access to. And it's not just about birth control. It's not just about this instance. It also could bleed over into things like the bills that we saw passed that would allow photographers the right to deny services to gay couples and other service providers. They could argue that they are guaranteed this right to this religious exemption. So it really could lead to a cascading effect where the bottom line is your employer has control over what you are allowed to get in your health care, which is just, I think, to most people absurd. Employers and corporations don't have a religion.
Now, Let me go back to Donald Trump for a minute, Congresswoman. You know, when he's not weighing in on health care laws, Fox brings out another person, the Iraq war architect Paul Wolfowitz, who had, well, let me let you hear what he had to say.
It seems to me, I hear numbers, I think it's correct, that 5 million people had their policies canceled, the ones that they were promised they could keep. So, presumably some of that 5 million of new enrollees are just people who got kicked out and are back in. This was supposed to reduce the number of uninsured. It may actually have increased the number.
Now, the Washington Post fact checker gave the claim that more people are uninsured for Pinocchio. So why do they keep saying this, Congresswoman? It's just patently not true.
I think Fox is getting pretty desperate to have folks on like Wolfowitz, and look at what he did for the world. I mean, he was the architect behind the Iraq War long before 9/11, and where has that gotten us? And Donald Trump, based on what does he have the authority to talk about health care reform? They need to stay doing what they're doing, but I do think it's a little bit of a sign of desperation that you go to sources like that to say how health care reform is working.
No, and clearly I disagree with the sources that they use, but the facts, Crystal, the facts are clear that that is absolutely, unequivocally untrue, as the fact checker at the Washington Post said.
It's absolutely false. And the fact that they have to reach for such absurd claims, I think proves the fact that they really are stretching right now to make the case against Obamacare when so many people are starting to see the benefits. I mean, we've seen Americans for Prosperity, this Koch-backed super PAC, trying to put up ad after ad with, quote, real victims of Obamacare. And each one of them keeps getting fact-checked and said, well, actually, this person is benefiting in this way and that way. They can't even come up with one credible person. The actual person in the commercial. They can't come up with one credible person who has really been a victim of Obamacare, as they claim.
Let me ask you this, Congresswoman. You're there in Washington, and you do a great job in Congress. So you talk to others in Congress on the other side of the aisle. Maybe I missed something, but do they have a health care plan? I mean, it's like they are arguing against the Affordable Care Act, Obamacare, but they're not proposing anything. I mean, how do you really say to people, I'm fighting against you having health care? It's not even like I'm saying, try my plan. I haven't heard their plan.
Right. Well, you know, Rev, I mean, I've been waiting now. I've been here for 4 years. I have been waiting for 4 years to hear about this plan. But every couple of months, they say, in the next few days, we're going to release our plan for health care reform. And it's been 4 years. We have voted over 50 times against the repeal of Obamacare. So they have no plan. And you know, the fact of the matter is that when the Congress and the President came up with the Affordable Care Act, they took many ideas from Republicans and added them in. So whether they voted for it or not, it was a bipartisan bill.
Including, they took ideas, Crystal, as the Congresswoman said, from Republicans, including Romney and his act that he had put in, executed in Massachusetts. Yet they're still talking about repeal. I mean, how do you look at people, young people with pre-existing conditions, older people, whatever, and tell them, be against this, but I'm not going to give you any alternative? How do you do that?
It's unconscionable, and it's going to become increasingly untenable. They can't continue in this direction because it's becoming more and more obvious that they have no alternative to offer. And we are now in a world where the Affordable Care Act is law, where people are getting covered. It is no longer going to be enough to demonize it. It's no longer going to be enough to say we have to repeal it. If they want to do something else, let's see what they want to do.
It didn't work. We have 1 week left. 1 more week left. That's all. Congresswoman Karen Bass and Crystal Ball, thank you both for your time tonight.
Thanks for having me.